And Sophie's playing right now. She's down here a little bit. There she is playing for the first part of our exam. She's coloring and putting stickers on a book. And for the purposes of this video, I'm going to be explaining a lot of what I'm doing out loud. To start off, we got vitals. We did blood pressure, heart rate, respirations, height, and weight. At this time, Sophie's already 3, so we don't really need to do a head circumference unless we think there might be a reason to, so we're going to defer that for now. And just as we start our exam, we're starting with her playing on the floor, and that way I can look at her musculoskeletal and neurological function. I'm looking for range of motion, skills, and evaluating gait, looking at muscle strength, that she's grasping, that she's able to pick out colors, so we know that her visual acuity is good, that she's able to put something where we ask her to. And as well, the parents have already filled out a developmental screening questionnaire on her skills and her motor coordination, social skills, and language. So that's been done before the exam started. And I'm going to continue. They're so cute. I'm going to continue. I see that she's alert and oriented, that she's cheerful. There's no signs of distress. And she's happy right now, so we start there. As well, I'm going to be looking at her skin, looking for lesions on any of the exposed areas, looking for any redness, any dry patches, anything that would be out of the ordinary. I'm kind of just assessing and inspecting what I can see right now. We're going to try to structure the exam from least distressing to most distressing. And she's so cute. Got the puppy dogs. Do you want to come sit on Mom's lap now?
Yeah.
Come here. Yes. You're all done. We'll use the other stickers later. Come here.
I don't want it to be.
Here, I'll hold those for now.
I want to do it.
Yeah, we'll put them on your shirt later.
Look it.
Perfect.
I will do the gun.
Okay, so I'm going to do some things like to do some checkup stuff, okay? Just like not your stuff, friends, okay? That's sweet.
I want to go down here.
Okay, so first thing I'm going to touch your head. Ooh, good head, tickle his head. So I'm looking at hair, looking at the thickness, that it's evenly distributed. I'm not seeing any hair loss. In her scalp, I'm not seeing any redness, I'm not seeing any scaling. I'm not feeling any nodules on her scalp. It's perfect. Hair distribution is even. She was playing with toys earlier, so I was able to see some visual acuity. And her eyes are at the appropriate position on her face. The auricles of her ears are in line there as well. I'm looking at her. And we're going to use the light now. Do you want to try to blow out the light? Blow it? Blow it.
You want to try?
Oh my goodness gracious. So I'm seeing she's able to close and open her eyelids. No swelling, no drooping, no redness. I'm going to look at your eyes. Good job. Okay, and so the conjunctive is translucent, it's free of arrhythmias. I'm going to look at the cornea and the iris. She's able to squint very nicely as well. Seeing clarity, round and regular, pupils equal size. Let's see. I'm going to hold up this crayon. What color is it?
Pink.
It's pink. Can you follow it this way?
Oh, look at it. Look at it with your eyes.
Now with your eyes.
Don't turn your head. Look at it. Look at it with your
Come
eyes.
on, hold your head. Sometimes that's good.
Where's the crayon?
Perfect. So we're just looking at all the extra ocular eye movements
Which
are
crayon?
good. I don't have an ophthalmoscope at this time, but we would do a fundoscopic exam here, okay? And we look for the red reflex as well. Okay, so now we're going to look at her ears. I'm not going to look in her ears at this time, just because that's usually one of the more distressing of the exams. So I'm looking at her auricles, like I said earlier. They're in line here. I'm gonna whisper something to you. I'm gonna whisper something and then you have to tell me what I said, okay? So I'm gonna do whisper hearing test. I don't have an actual hearing test with me.
What did you say?
Yes, so princesses, I'm gonna do one more word, okay? What did I say? Oh, perfect, good job. Okay, so I'm also gonna look at her nose. External nose looks good. I'm not seeing any drainage. I'm not seeing any arrhythmias. She's only 3, so maxillary and frontal sinuses aren't really developed. Usually not assessed until 4 for maxillary sinuses and 7 for the frontal sinuses. Also, I'm gonna look at the lips.
So pain.
They're red. Oral mucosa is moist from what I can see so far. Can you show me your teeth? Perfect. So we're seeing the cranial nerves here. Also, she shows her teeth. Her teeth are white. They're in line. She's got a lot of her teeth, most all of her teeth in. And we'll look in her mouth when you look at her ears. Let's see. I'm gonna to feel your neck. Okay. Just gonna feel it. Ooh. Good job. Okay, so I'm not feeling any cervical lymph nodes at this time. So from going behind her, I'm going to try to palpate for her thyroid and see if she swallows for me.
Can you swallow?
No. Awesome. Not feeling a normal size here for the thyroid. As well, like I said, no cervical lymph nodes. Can you stand up for me? Touch your toes. Perfect. So we got good bend to your spine. Everything's been symmetrical. And your toes are growing. Can you come sit with mom? We're gonna listen. We're gonna use the stethoscope. Remember?
Stethoscope.
Remember the stethoscope? So back exam was normal so far. And like I said, we would want to be able to see the spine, but at this time we'll defer that. Okay. So I am gonna look at your tummy real quick. Can you take a deep breath for me? Okay, so we're seeing symmetry in her abdominal muscles, breathing. She's an abdominal breather at this point still, so we're seeing rise and fall. And I'm going to come under here, and I'm gonna palpate. Sophie, can you say princesses? Can you say Mickey Mouse? Oh, good. So, symmetrical tactile foramis, and I'm gonna try to check for. Gonna percuss for dullness here. All resonant sounds so far that I've heard.
Good job, honey.
I'm gonna tap, 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 tap. Tap, tap. Good job. Okay, so all so far I've heard is just resonant sounds, low and loud and low, dull, resonant sounds. And now we're gonna listen to our lung sounds. Okay, do you remember this part? Yeah. Okay. Good. Wow. Good job. One more. Perfect. And here. Deep breath in. Just like that. Perfect. You're so good at that. So I'm assessing both sides of the lung fields. Deep breath. Oh, good job. I'm not hearing any wheezing. One more. Perfect. And then the last one right here, I'm not hearing it. It's clear. I'm not hearing any wheezing. I'm not hearing any advantageous breath sounds in any of the lung fields. Comparing right and left, as well as the ventral and dorsal side, and that sounded great. Then I'm gonna listen to your heart, Sophie, just like last heartbeat. Your heartbeat. What does it sound like? Thump, 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 thump. Exactly. Good job. Okay.
Ready? Hold still so she can hear your heart loud.
Hear your heart. Listen for me. I'm hearing S1 and S2. Not hearing any murmurs. You can hear her heart really well. Seeing that side of the stethoscope, and I can hear in all 5 areas here S1 and S2, and no murmur or gallop noted. We are almost done, Miss Sophie. Okay, I just need to listen. I just need to listen to your belly. And
What do bellies say?
Rumble.
rumble, rumble. You're right. That's perfect. Rumble.
Diamond needs to lie your poop and back.
So first, I'm gonna inspect real quick. I'm looking at.
Poop and belly.
Not seeing any, I'm not seeing any umbilical hernias. I'm not seeing any protrusions at all. Symmetrical. I'm seeing that she's abdominal breathing, and I'm going to auscultate first. And we know it's almost dinner time, so. Just hearing, not hyperactive, but just some bell sounds. Not a whole lot. Great. Okay, now that I'm done auscultating the abdomen, I'm going to go ahead and palpate lightly. I'm just going to press, okay, a little bit.
Just gonna feel your tummy. See where it is. Is your tummy hiding in there?
Yes.
What does it get full of?
Chips.
Chips! That's what's in there. I'm going to press kind of deep. Does this hurt you?
Oh no.
No. So we're not having any tenderness. You're doing great. No, nothing's hurting you? No, it's ticklish. Okay, and then going to percuss for the liver and spleen. And so when I'm
Oh my
looking,
God, she's gotta do one other thing.
when I'm looking for the liver and
She's
try
gotta do a
to
little more. Wait.
try to find the border where the dullness stops.
Oh, that's a little cold.
And so you can hear the dullness change. So the liver borders are in the normal area here. The liver seems to be of normal size.
Three of them, or is it?
The liver over here. And we also have the spleen here, which we can find. Great job. Okay, awesome. You can sit up on mom's lap a little more. We are seriously almost done. We got your favorite thing, which is looking in your ears, huh? Yes.
Your ears?
Okay. Like I said, looking at her skin, not seeing any redness, not really seeing any dryness. I know mom had mentioned at some points she does get dry skin. At this point, she was looking moist and smooth and no lesions, so it's a good time. So we're gonna look in her ear. So we're gonna pull still, back it up here. Turn this way.
Nerves, so she can see it.
Okay, so we got the tympanic membrane here. It's a dull, pearly gray. The bony structures are intact. I'm not seeing any fluid. I'm not seeing any redness. Looks great. Okay, I'm gonna do one more. You're doing so good, Sophie. Oh. Same thing on this ear. Bony prominences. Pearly gray for the tympanic membrane. The light's not diffused, but very good refraction on the light. That's perfect. Okay, you're doing awesome. Now I'm gonna look at your nose, okay? abnormalities, no swelling noted. And I'm gonna open your mouth now.
Remember to say "ah" with the tongue way out.
Tongue out. Okay, perfect. I can see her tonsils there. I can see that her tongue is moist, that it's pink inside. I'm not seeing an exudate on the tonsils. No swelling noted. I can see her teeth. This is helping me look at some of the cranial nerves as well. She can do this for me. Perfect. And I don't have a tongue bleeder. I would try to elicit the gag reflex to look at the cranial nerve there as well. So we've looked at all of those things.
Alright,
You did so good with that, Sophie. That was so good.
Allison's gonna try 2 more
I'm
things.
going to. Can I see your pretty pink fingernails real quick?
Sure.
So I'm trying to look for a space where I can see the capillary refill, and I can see that it's less than 2 seconds. It's very, very quick, and that's great. This whole time as I've been doing her exam, I've been looking for cranial nerves. We don't have a Snellen chart, so I can't actually do her vision test, but I was able to see cranial nerves 3, 4, and 6 with the extraocular eye movements, as well as cranial nerve 5, because Mom fed her a snack right before we started, and I could see that she had good symmetrical jaw movement. As well, she's been able to smile for me, show me her teeth. She's been able to, with cranial nerve 7, she's been able to whisper, or when I whisper, she can turn. When I talk to her, she looks at me. Cranial nerve 8, like I said, I couldn't elicit the gag reflex for 9 and 10, but for 11 and 12, she was able to stick out her tongue for me, so we assessed it there. As well, just finally, for her neurological status, like I said, she was alert and oriented. She's obviously full of movement, and she is able to look at the light. She has sensation, and she can. What am I touching here? Tickling her legs. She has a sensation on both legs, and in the proximal areas real good. I don't have something to elicit the reflexes here, but I would do that as well at this time. And that really concludes the end of our physical exam, so thank you to Sophie and